Welcome back to Muff, Minutes Until Fit. This is your host, Imani. Our mission here on this channel is to create awareness on different illnesses. The information contained in this video is of general nature and does not constitute medical advice. Talk to your doctor for your individual circumstances. This week we will be covering addiction. Don't forget to hit the like button and subscribe to my channel at the end of the video. What is drug addiction? Drug addiction, also known as substance use disorder, is a disease that affects the brain and behavior. It leads to inability to control the use of legal or illegal drugs. Alcohol, marijuana, and nicotine are also considered drugs. When people are addicted, they continue using drugs despite the harm it causes. Drug addiction usually starts with experiment with the drugs at first, like with peers or at a party or social event. The risk of addiction and how fast you become addicted varies by the drug. Cocaine, stimulants, and opioid pain meds can cause addiction quicker than other drugs. You should start to worry if, as time passes by, you need larger doses of the drug to get high. Then you will start wanting it just to feel good. As you continue to use the drug, you will increase the amount of times you use, and you will find it hard to go a day without the drug. This may cause intense cravings, it can make you sick, or you can have withdrawal symptoms. Symptoms. Drug addiction symptoms or behaviors vary from person to person, depending on what drug it is. So, feeling as if you need to use the drug regularly, can't think of anything else but the drug and getting high, taking more of the drug to get the same effect, spending money on the drug even though you can't afford it, behavior changes and your circle of friends change, you start stealing to get the drug, if you experience withdrawals when you don't have the drug, responsibilities and obligations are not being met. How addiction works. We become addicted to drugs or activities because we like the way it makes us feel. Different substances approach the limbic system, which is the reward center in the brain, in different ways. But all substances of abuse cause the brain to release high levels of dopamine. When using drugs, the brain will produce 2 to 10 times more than our brain usually makes. And it makes the user feel a rush or high. When dopamine is released in an abnormal way, the brain struggles to regain its normal chemical balance after a substance wears off, and it produces a hangover effect or withdrawal. Using drugs for a long time can lead to the brain decreasing the amount of dopamine it naturally makes, leading to physical dependency. Once the brain's motivational center becomes reorganized, the top priority as far as the brain is concerned is finding and using the substance. The brain has taken over the body, and the addict is no longer in control of his or her behavior. Initial drug use is a voluntary act, but behavior psychologists seem to think that's not the case. Risk factors like genetics, peer pressure, psychological disorders, anxiety, depression, the quality of a person's home life. They say all these things contribute to becoming an addict, and it also can cause behavior problems. Different drugs produce different levels of high, hangovers, addictions, and cravings. Some will produce few physical withdrawals but strong cravings. Physicians consider alcohol more dangerous to suddenly withdraw from than any other drug like heroin or cocaine due to the physical symptoms that come with alcohol withdrawal. People can also become addicted to things like sex and food. Research continues to investigate ways to break the addictive cycle. They have lots of information on addiction on the genetic level and in the brain process. Researchers have managed to isolate a number of genes, hormones, and chemicals in the brain that are directly related to certain types of addiction. Researchers have formed the basis that could lead to the creation of drugs that treat specific addiction. Research has shown that genetic predisposition is most likely caused by a number of genes working together. Research has also shown that genes play a role in making people less susceptible to addiction. Some people actually have genes that can help them never become addicted to drugs. Genetics are isolating genes, hormones, and chemicals in the brain that react to specific substances. Further research could help us one day cure addiction as a chronic disease. Why people may decide to use drugs. People with mental health disorders like depression, ADHD, PTSD will likely become addicted to drugs as a way of coping with painful feelings like anxiety and loneliness. Peer pressure is a strong factor in starting to use and misuse drugs, especially for young people who want to be with the in crowd. Lack of family involvement, difficult family issues, or lack of attention at home, no bond with parents or siblings, no parental supervision, rejection from family and peers. Environmental factors could play a role if you live in a drug-infested area. Genetics, the development into addiction, may be influenced by inherited genetic traits that may delay or speed up the disease process. Marijuana, hash, and cannabis containing things. Cannabis can be smoked, ate, inhaled, or vaporized. It is also usually used along with other substances like illegal drugs and alcohol. Marijuana acts as a neurotransmitter attaching the dopamine receptors and causing the release of dopamine in the brain. Symptoms: red eyes, dry mouth, slowed reaction time, munchies, feeling really high, anxiety or paranoid thinking, increased blood pressure and heart rate, can't concentrate or remember, loud odor on your clothes, yellow fingertips. K2, spice, and bath salts. Synthetic cannabinoids and substituted or synthetic cathinones, illegal in most states. The effects of these drugs are dangerous and unpredictable, and there is no quality control, and some ingredients may not be known. Synthetic cannabinoids, also called K2 or spice, are sprayed on dried herbs and then smoked, and also can be prepared as an herbal tea. These things are made with chemical compounds rather than natural or harmless products. These drugs produce a high similar to marijuana. Symptoms: feeling high, elevated moods, extreme anxiety or agitation, paranoia, hallucinations, vomiting, confusion, altered sense of vision, hearing, and taste. Bath salts. Bath salts are mind-altering substances similar to amphetamines, like ecstasy and cocaine. Packages are labeled as other products to avoid detection. Despite the name, it's not a bath salt like Epsom salt. Substituted cathinones can be eaten, snorted, or injected and are highly addictive. This drug can cause severe intoxication and result in dangerous health effects or even death. Symptoms: increased energy, increased sex drive, problems thinking clearly, panic attacks, psychotic and violent behavior, euphoria, delirium. Barbiturates, benzodiazepines, and hypnotics. These are prescription central nervous system depressants, often used and then misused for a sense of relaxation or a desire to switch off and forget stress-related thoughts or feelings. Barbiturates, phenobarb and secobarbital. Benzodiazepines are sedatives like Valium, Xanax, Ativan, Klonopin, and Librium. Hypnotics are sleeping meds like Ambien, Intermezzo, and Sonata. Symptoms: drowsiness, slurred speech, lack of coordination, slowed breathing, decreased BP, which is blood pressure, falls or accidents, dizziness. Methamphetamine, cocaine, and other stimulants. Stimulants like methamphetamine, cocaine, Ritalin, Concerta, Adderall. These are often used and misused in search of a high or to boost energy, to improve performance at work or school, or to lose weight or control appetite. Symptoms: feeling exhilarated and excess confidence, increased alertness, increased energy and restlessness, insomnia, rapid rambling speech, dilated pupils, confusion, delusion, and hallucinations, impaired judgment. They can also develop meth mouth, which is mouth sores, gum disease, and tooth decay from smoking drugs. Club drugs are used at clubs, concerts, and parties. They consist of flunitrazepam, ecstasy, Molly, roofie, ketamine, GHB. Those drugs are not in the same category but have similar effects and dangers included. Long-term harmful effects. GHB and flunitrazepam causes sedation, muscle relaxation, confusion, and memory loss, potential for sexual misconduct or sexual assault, which can happen with these drugs. Symptoms: chills and sweating, tremors, behavior changes, poor judgment, muscle relaxation, poor coordination or problems moving, reduced consciousness, memory problems or the loss of memory. Hallucinogens like LSD or PCP are the most common. These drugs produce different signs and symptoms. LSD, reduced perception of reality, rapid shifts in emotions, tremors, flashbacks, permanent mental changes in perception, impulsive behavior. PCP, a feeling of being separated from your body and surroundings, lack of pain sensation, problems with thinking and memory, sometimes seizures or coma, problem coordination and movement, intolerance to loud noise. Inhalants, signs and symptoms vary depending on the substance. Inhaled substances include glue, paint thinners, correction fluid, felt tip marker fluid, gasoline, cleansing fluids, and household aerosol products. These substances are very toxic and users may develop brain damage or sudden death. Symptoms: brief euphoria or intoxication, possessing and inhaling without good reason, combativeness or belligerence, irregular heartbeats, seeming intoxicated with slurred speech, slow movements and poor coordination, rash around the nose and mouth, nausea and vomiting, dizziness. Opioid painkillers, which we are in an opioid epidemic still, so the use is very high. Narcotic painkillers made from opium or synthetically made. These drugs include heroin, morphine, codeine, methadone, oxycodone, and Percocet, and others. Symptoms: decreased sense of pain, agitation, drowsiness or sedation, slurred speech, constricted pupils, confusion, constipation, lack of awareness or inattention to surrounding people and things. How to get diagnosed. To diagnose drug addiction, the patient will require a thorough evaluation and often includes an assessment by a psychiatrist, a psychologist, or a licensed alcohol and drug counselor. Blood, urine, and other lab tests will be done. There's no diagnostic test for addiction. The tests are usually used for monitoring, treatment, and recovery. When to see a doctor. If your drug use is out of control or causing problems in your life. If you can't stop using a drug. If you continue to use a drug despite how harmful it is. If drug use has led to unsafe behavior like sharing needles or unprotected sex. If you think you are having withdrawal symptoms after stopping drug use. If you are not ready to confide in a doctor just yet, helplines and hotlines may be a good place to start. When to seek emergency help. If you or someone you know has overdosed. If you or someone you know shows changes in consciousness. If you or someone you know has trouble breathing. If you or someone you know has seizures or convulsions. If you or someone you know has signs of a heart attack like chest pain or pressure. If you or someone you know has any other troublesome reaction to the use of a drug. Staging and intervention. An intervention should be carefully planned and may be done by family and friends in consultation with a doctor or licensed alcohol and drug counselor. An intervention presents a friend or loved one with the structured opportunity to make changes before things get even worse and can motivate someone to seek or accept help. A few people gather together to have a direct heart-to-heart conversation with the person about the consequences of addiction. Treatment. There's no cure or drug for drug addiction, but there are several treatment options that can help you overcome addiction and stay drug-free. You have to be willing to be committed long-term to stay drug-free. Treatment really depends on the type of drug used and any related medical or mental health disorders. Individual or group therapy sessions. Understanding the nature of addiction. You may need outpatient, residential, or inpatient programs. You may need medications. Detoxification or withdrawal therapy enables you to stop taking the addicting drug as quick and safely as possible. Detox may involve gradually reducing the dose of the drug, temporarily substituting other substances. Behavior therapy, a form of psychotherapy done by a psychologist or psychiatrist, licensed alcohol and drug counselor. Therapy helps you with ways to cope with your drug cravings. It suggests strategies to avoid drugs and prevent relapse. It helps you to know how to deal with a relapse if it occurs. They talk about issues of life like your job, family, friends, legal problems, and relationships. They include family members to help them develop better communication skills and be supportive. They address other mental illness conditions. Self-help groups. 12-step model was first developed by Alcohol Anonymous, AA. We have a Narcotic Anonymous that helps people who are addicted to drugs. Addiction is a chronic disorder with danger of a relapse. Self-help support groups decrease the sense of shame and isolation that can lead to relapse. How to spot unhealthy drug use in your family members. They start to have problems at school or work, missing days, not interested in activities they were liked by before, decline in grade or schoolwork performance, red eyes, decreased energy, decreased motivation, neglecting grooming and overall appearance, secretive, don't want anybody in their room, drastic changes in behavior, money and items missing from your home. Other life-changing complications: contracting a communicable disease, legal issues, family problems, work or school issues, accidents, financial problems, other health problems. Prevention of drug misuse in children and teens. Number one way to prevent addiction to a drug is not to take the drug at all. Communicate. Talk about drugs and their effects on life. Listen carefully when your children talk about their day and peer pressure. Never make them feel as if what they are saying doesn't matter. Set good examples. Don't misuse alcohol or addictive drugs. Strengthen the bond between you and your children so that they feel close to you and feel as if they can confide in you about anything. Preventing a relapse. Stick with your treatment plan. Go to meetings, take medications. Make sure you have a sponsor who can help you with when you have cravings. Stay away from your old drug crowd and do not go back into the neighborhood where you bought drugs from. Get help right away. If you use the drug again, and don't be ashamed if you do. Don't feel like you failed. The road won't be smooth the whole way. There will be bumps along the way. Overcoming an addiction and staying drug-free requires a persistent effort. Learning new coping skills and knowing where to find help is mandatory. Join a support group where you will be with people that you can share experiences with. This has been your host, Imani. And I just want to say thank you for tuning in again. Don't forget to hit the like and subscribe button at the end of the video. Just want to tell everybody to stay positive. Until next time.